Okay, pleural effusion. Let me tell you about my patient. I went to Chest Hospital today. My patient had cancer of her breast. Her breast was surgically removed. She has pleural effusion, accumulation of fluid in the pleural cavity, and she also has hypertension. She has that since she was 20. She's 46 years of age, and she's a Christian. It doesn't work. She's married, and that's it. All right. I did assessment of her. It's a 2 assessment. Skin is clean. Eyes. Focus assessment is on her chest. With my stethoscope, listen to her chest. There was a bit of wheezing. Her heart was beating normal. Abdomen was soft. Before I go down to the abdomen, her breast was surgically removed. There is a dressing there, and also a surgical incision was done for pleural cavity. It was done at the bedside, where they insert a needle and a tube. They drain the liquid, and it was blood stained. They have a glass bottle underwater seal on one side, start from 0 where the liquid is, and on the other side of the bottle start from 300. Now if you want to count the amount of fluid, that's just the fluid only that is accumulated, that was drained, you start from 0. If you want to include the water in the bottle, you start at the 300. 0 for the amount of fluid in her pleural cavity, and 300. Yeah. All right. She's on face mask. She had on a face mask. I did her autostat. They changed it. Our autostat was 98, and they changed it to nasal cannula. All right. Her abdomen is soft and tender to touch. Her limbs, lower limbs, from her ankle down, was edematous. Diagnosis that I would use for this patient: acute pain, ineffective breathing pattern, and disturbed self-image, because she did not want me to look at her. She was saying that she don't want to take off her clothes and all of that. And she was guarding, like she did not want you to look at her, you know. What I would do for my patient, I would teach her about the importance of keeping in the nasal cannula for breathing, SOB, because without it she will have shortness of breath. And the symptoms for pleural effusion pleural effusion is shortness of breath and pain, chest pain. She had both of those. Alright, I would teach her about her condition, teach her to sit up in bed in an eye fowler's position. They put pillow behind her in the bed if it's not high enough. This will prevent shortness of breath and difficulty breathing. I would assist her with her hygienic needs, her daily hygienic needs, that she's feeling a bit weak. And make sure that she eats properly and she drink fluid. She would not be dehydrated because she's not losing electrolytes. She's losing blood, so yeah, she has to eat food, iron, rich in iron, and you have to give her a supplement. Yeah, I think she's on that. All right. The diagnostic procedure that we will do: X-ray. They do also CT scan to look at the fluid in our lungs, in our pleural cavity, and ultrasound. Remember? Hold on. Oh, hold on. Let me look. Okay. Yeah. Ultrasound would show where the liquid is. It should show it more clearly. All right. So, X-ray, CT scan, or ultrasound diagnostic test. All right. The medication that she's on Enapryl. She has high blood pressure since she was 20. So I did her BP. Her BP was 100/60. Yeah. Priority. I would also monitor vital sign. Respiration is important. Our auto-stat is important. Make sure that you check it on our finger. Yeah, breathing, respiration, or BP. Yeah, vital sign. Alright, she's on diuretics, HCTZ. She's on baralgin for pain. Mist morphine is a DDA drug. She's on that also. She's on Ventolin for breathing. Zantac, ILV, that is a vitamin supplement. Iron, something LNV, whatever. Sorry, not whatever, but I'm not sure. I'll go and read. Aramidex, I don't know what that's for. I have to read that up. Dulcolox, I have to read that also. So yeah, that's my patient for today. Pleural cavity, pleural effusion. Yeah. Okay, so I hope you learned from me, and I learned today. So tell me what you think of my YouTube video. Okay, bye.